Hello everyone, welcome to my channel. My name is Nurse Pauline RN. The title of my video today is Fundamentals of Nursing, Assisted Devices, Walkers, Canes, Crutches, CPM Machines. We're talking about going upstairs using crutches. When you're going upstairs, you go upstairs using your good leg or your unaffected leg first. Good legs go upstairs first. When you're going downstairs using crutches, the weaker affected leg, injured leg goes down first, followed by the good leg when you're going downstairs using crutches. Going upstairs, you use your good leg going up. Going downstairs, you use your weaker leg going down with crutches. Next, we're talking about 2-point crutches. 2 points mean 2 points should always be on the ground at the same time. One crutch, one leg at the same time on the ground. Swing through crutches mean that you will swing through the crutch and you will swing in front of the crutches. Before we do a swing through GAIT crutch, we should assess the patient for adequate muscle balance in arms and legs. The patient will swing towards the front of the crutches. Swing in front of the crutches. We're talking about swing to crutches. Move both crutches forward. The patient will swing first where the crutches are. When you're walking with a walker, we will ask the patient to move the walker forward a little. The injured or weaker leg will ask the patient to move forward first, followed by the good leg, placing it slightly in front of the weaker leg. When you're using a cane, the cane always goes on the good side, opposite of the affected, weaker, or injured side. The cane is always placed on the good side, firmly to the ground. When we're teaching patients about CPM machines, CPM means continuous passive motion exercises. These machines are used to do isometric exercises. These CPM machines are used for patients post-knee replacement. CPM machine reduces the joint stiffness and improves range of motion exercises. Teaching for patients that these answers may appear on your examination. You should know first priority is safety. Do not use someone else's crutches. Crutches are measured only for patients. Remove scattered rugs. Have spare crutches. Have spare tips. Both elbows should be flexed when using crutches. Measuring crutches should be 2 to 3 fingers from axillary. Please hit the like button. Please subscribe. Please share this video. Thank you. Have a blessed day.